Hello, my name is Yosnaki Perez, and I will be giving an informative speech on liver cirrhosis. Who here likes to party and have a good time? Raise your hand. Does anyone like to drink alcohol to have fun? Well, that is what my uncle did for most of his life. He now has end-stage liver cirrhosis, which is a fatal condition. People who tend to be heavy to moderate drinkers are more likely to get cirrhosis of the liver. The liver is the largest gland in the body located in the upper right quadrant of the abdominal cavity. This organ weighs about 3 pounds in the average healthy adult. The liver carries out several vital functions, including detoxifying toxic chemicals and cleansing the blood to make important bodily nutrients. People who are diagnosed with this condition are on their deathbed unless they get a liver transplant. But the list is long. You must be thinking to yourself, what exactly is cirrhosis? Let's get started talking about the causes, symptoms, and prognosis of cirrhosis. Cirrhosis refers to the chronic destruction of liver cells and structure, commonly due to an alcohol addiction. Due to the toxins, the liver becomes scarred, damaged, and attempts to repair itself. Instead, the liver creates non-functioning liver cells and becomes small, very dark, and produce many fibrotic nodules. Now, let's examine the symptoms and treatment for cirrhosis. This debilitating disease can cause jaundice, ascites, enlarged blood vessels, fatigue, enlarged spleen, and itchy skin. All these symptoms cause the patient's health to decline and many times result in death. You can imagine how uncomfortable this must be for someone like my uncle. Currently, there is no cure for cirrhosis. The only way of surviving this disease is to get a liver transplant and hope your body does not reject it. Also, people with alcohol addiction will automatically be bumped off the transplant list because of their alcohol instability, and there are plenty of other honest, viable candidates. Not to mention, finding a liver that matches your blood type is not easy. People are on the list for years and pass away before they ever get a second chance. A liver transplant is not a choice for many people in liver failure. Now that you know a thing or two about cirrhosis, let's talk about the prognosis. The prognosis is fatal and completely irreversible. Patients undergo a series of health analysis and psychological evaluations to ensure the organ would not be wasted. Due to these evaluations, many people are turned down every year due to their deteriorating health or addiction. According to the University of California, if a patient is still addicted or prone to relapse, they will most likely not be chosen for the liver transplant because it would be a waste of an organ. The relapse will only damage the new organ and create more problems within the patient. So the liver will go to someone who will treat their new liver good. Without a liver transplant, patients do not last more than 15 years after their diagnosis. Now that we understand what cirrhosis is, let's recap what we have covered. Basically, cirrhosis is a serious end-stage liver disease that makes the liver fibrotic and non-functioning. The liver tries to repair itself from the damage due to the toxins and causes scarring, or the medical term fibrosis. The cells begin to replace old working cells and the liver can no longer function properly. Addiction is a serious illness in its own, but cirrhosis is a fatal disease and painful way to leave the earth. Think about your loved ones the next time you pick up that drink, and remember how important it is to drink responsibly and live a healthy and happy life. Thank you.